The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy, a local Health Mart pharmacy. And I'm your pharmacist, Paul White. And we are very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, Kiko Auctioneers and Realtors, and of course, our technical producer, J.D. DeAngelis. In the studio with me is Brad White, a compounding pharmacist, and our special guest this morning, Dr. Greg Boone, breast cancer surgeon, and Diane Wofsey, breast cancer navigator from Mercy Medical Center. Good morning, folks, and welcome to the show.
Good morning.
Good morning.
October is Breast Cancer Awareness Month, and today we're working with Mercy Medical Center Cancer Center to raise awareness about breast cancer. According to the National Breast Cancer Foundation, when detected early, it is in a localized stage, the 5-year relative survival rate is 100%. Early detection is key to good health and includes self-breast exams, regular clinical exams with your physician, and mammograms. Today we will explore some myths associated with mammograms, diagnosis, treatment, options, and more. We'd like to remind our listeners that today's program is available on our podcast, and it can be downloaded from the App Store on your favorite smartphone, and you can listen to any of our programs anywhere, anytime. If you have questions you'd like addressed today, you can post them up on our live Facebook feed, or you can give us a call here at the radio station at 330-450-1480.
So, Dr. Boone and Diane, please tell us a little bit about yourselves and your roles at Mercy Cancer Center.
Well, I'm Dr. Boone, and I am one of our breast surgeons at the Cancer Center. Diane, of course, is our nurse navigator and is an integral part of our team. And, you know, I think the important thing to know about the Cancer Center is that we are a real team. So it's not just Diane and I. There's a whole team of people that work together to make sure that our patients get the best care possible. You know, that starts with our primary care doctors who may well send their patients for a screening mammogram or identify some abnormality, a lump in the breast that they need evaluated. They then send them over. We get them in, we do some imaging studies. Our radiologists will real-time review those studies, and if they have abnormalities that need further evaluation, they'll make those recommendations and hopefully get those tests done immediately or in the very near future. If they do end up finding an abnormality that needs further workup, that's when the surgeons get involved, and we try to sit down with the patients, come up with a plan of how are we going to diagnose this, what are we going to do. Those diagnostic procedures are usually minimally invasive procedures, needle biopsies with ultrasound guidance frequently done by our radiologists, or mammogram-guided biopsies done by either the radiologist or the surgeons. Once we get that tissue, of course, then it goes to our pathologists, who are another part of our team, who can give us a diagnosis. If it is a cancer, they can do special studies that help us to define whether these patients will respond to certain treatments like hormone-blocking drugs, etc. At that point, then we formulate a plan for how are we going to treat that disease, and that's where the surgeons and the plastic surgeons sometimes come into play to, decide how are we going to treat this disease locally in the breast. How are we going to restore normalcy in the case of women who may need or desire a mastectomy, get our plastic surgeons involved. After that, of course, our oncologists, both medical and radiation oncologists, are involved to help us to define, again, what treatments above and beyond surgery that we might need, chemotherapies, hormone-blocking drugs, radiation therapies to help, prevent local recurrence and enhance long-term survival. Even beyond that, we have Diane and her team of navigators who are behind the scenes this whole time, making all of these working, moving parts go smoothly for the patient so that it's this seamless road down this journey that you have to take, unfortunately, when you're diagnosed with breast cancer. And they have things beyond the treatment phase into survivorship. So we have pastoral care services. We have groups that meet, cancer support groups, breast cancer support groups. We have our boutique where patients who have lost their hair from chemotherapy, can get wigs, scarves, etc. So it's really a huge team of people that make this work and make it work well.
Oh, interesting. And Diane?
I get involved with the patient almost from the get-go. When they first find out that they have an abnormality on their mammogram, they get me involved. So I'm kind of that liaison between the patient and the surgeon and help get their appointments made, do all of those kind of things. So what we try to do is take as much of the burden off of the patient so that she basically just has to show up for these appointments. We try to do as much of the legwork for her, is what the Navigators work on doing.
Interesting. So where does breast cancer sit in the percentage of cancer patients, a la lung cancer?
In women, it's the most common cancer besides skin cancer. Yeah. So, skin cancers, of course, are very common, most of them minor skin cancers, but it is the most common cancer in women. So it's a very common disease. If you look at a woman's lifetime in America, 1 in 8 women will be diagnosed with breast cancer. So it's an extremely common disease.
Wow. So October is National Breast Cancer Awareness Month. Why is this such an important focus?
I think if I look back to when my career first started in nursing, it was one of those things that people really didn't hardly talk about. Women kind of kept it quiet. Yeah, sure. And now everybody, I guess I could say in some ways, the world turns pink on October 1st. And I'm not sure, other than pink was always associated with a girl color, but you see pink ribbons, the color pink, just about everywhere you go anymore. And I think it has, hence Dr. Boone's pink scrubs over here.
Doctor is in pink scrubs. Now, is everybody in the hospital in pink scrubs now?
No. He's our actual designated, real men wear pink guy. Right. So he has been in something pink the entire
Since
month
October
of October.
1st. Oh, my gosh, no kidding. Okay.
Yes. So he's made quite the statement in these pink scrubs. But if you notice, you can't turn on the TV, you can't go anywhere the month of October. Everything from the celebrities in Hollywood to all of the national sports teams, everybody does something now that promotes this, which I think really has increased the awareness of it.
It's in every magazine you pick up. I can't believe it. How encompassing it is.
Okay, so you said 1 in 8 women could be diagnosed with breast cancer. So I'm wondering, as our technology has advanced and hopefully our diagnostic skills have advanced, are we finding more cases because we are better at monitoring and screening and raising awareness in months like October with breast cancer awareness, or is it on the rise?
Yeah, so I think it's both, actually. We certainly are finding more. Women are just more aware of the disease. They're taking more control and of their health, and so they're insisting on good screening and seeing their doctors and doing their self-exams. And we've done a good job, I think, educating people on the importance of screening. So I think that's part of it. We're finding more because we're doing more screening, and we're doing better screening than we did in the past. But that's not the entire answer. I think the disease is, in fact, increasing in frequency. Of course, the big question is, why is that? And I don't think we have an answer yet.
Yeah. There seems to be some debate in recent years about breast cancer screenings. When and how often should a woman be screened for breast cancer?
Well, boy, that is a tough question to answer. And, of course, I have my own personal opinion about that.
And I'm sure the insurance company does, too.
And the insurance company certainly does, too. So, yeah, there was a lot of controversy a few years ago. A government agency on cancer prevention came out with a statement that I think a lot of we physicians who treat breast cancer weren't very happy about. It's controversial, especially between the ages of 40 and 50, how often you should have it. And then in later years, when you're beyond 75 or so, how often, if at all, you should have mammograms and screening. The American Society of Breast Surgeons of which I'm a member, they suggest that between the ages of 40 and 45 that you have a discussion with your doctor and kind of come to a consensus with yourselves about whether you want to be screened then or not. There is some data, I think, that suggests that there is some benefit to doing that as far as mortality because of early detection. Beyond 45, they recommend yearly screening. When you hit the age of 75, then it becomes a matter of what is your life expectancy, so you have to take things into account such as comorbidities. I think most people would agree that if you have a life expectancy of 10 years, you certainly should probably be screened. But it's controversial. There is no one agrees at this point.
Who decides your life expectancy?
Yeah,
Wait a minute.
Yeah, not me.
Okay. That's kind of a ringing thought. Okay. You lady over there, you're not going to get screened because you're 75 and you got bronchitis or, asthma or something like that.
Yeah, it's a tough decision. And again, I think it's important that patients speak with their doctors and talk about what their general health is and does it make sense to do screening or doesn't it make sense to do screening. Surprisingly, there are some times when you just look at things and say, this really looking for problems when they don't exist is probably not beneficial for this person.
Okay.
So, speaking of screenings, there's still a lot of myths and misconceptions about mammograms and radiation exposure. Some women will not have a mammogram because of fear that the radiation will give them breast cancer or that it's painful. Can you talk about the realistic risk of radiation exposure related to mammograms and the process itself? I mean, I only want to add that I know that I usually use my wife as a barometer in these things, and she feels like it's not that big a deal to get a mammogram. She feels like the process is, it's not the most pleasant, but it's something you do to be safe and get screened, and it's not really worth avoiding the process just because of the procedure. So,
well, I'll let Diane talk about the procedure because I personally haven't had one, so I think she'll be better equipped at that. As far as the radiation exposure, it really is a minuscule amount of radiation that women are exposed to. And you can talk a bunch of fancy numbers of millisieverts and things like that. But, in fact, our background radiation, just living, breathing, walking around in our normal environment, you get from a mammogram what you would get from your normal environment in about a 2-month period. So it's really a very minuscule amount of radiation that you get from a mammogram. It's certainly not something that would keep me from recommending that for my family.
Okay, we'll pick up on your answer when we get back, okay? You are listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
It's that time of the year again. It's time to protect your family against the flu virus. Hi, this is pharmacist Paul White from the Medicine Center Pharmacy. Flu vaccination should be a priority to you and your family, so take the steps today to protect yourself. Visit us at any Medicine Center Pharmacy and get your flu shot. And don't forget to stock up on items to boost your immune system like probiotics and multivitamins. Medicine Center Pharmacies are conveniently located in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
You won't want to miss this upcoming Kiko Absolute Auction, Saturday, October 27th in Poland, Ohio, with auctioneer Bill Gill Jr. You'll find antique and modern furniture as well as quilts, kitchen items, china, pottery, household items, and antiques, a Cub Cadet, and the auction of a 4-bedroom home. Mark your calendar for Saturday, October 27th, starting at 10:30 a.m., followed by the real estate auction at noon, located at 2915 Palmieri Drive in Poland in Mahoning County. Call Bill Gill Jr. 330-418-8727 or visit KikoAuctions.com for pictures, directions, and more information.
Welcome back to Health Matters with the Medicine Center Pharmacy. Today we're talking about breast cancer with Mercy Cancer Center's Dr. Greg Boone, breast cancer surgeon, and Diane Wofsey, breast cancer nurse navigator. Have a question? Post it on our live Facebook feed.
Okay, before the break we were talking about the concern of radiation with a mammogram. And how about we talk with Diane now about the process and when maybe the best time to get it is?
So mammograms are over with in a matter of a few minutes. So I think for the most part, it's a very short exam, considering how many other medical tests a lot of people have in the course of their life. However, if you are younger and you're still having menstrual cycles, if you schedule your mammogram at a time that's shortly after your cycle ends, when the breasts aren't as tender, that may help for those that have discomfort when they're having that mammogram done. We do have to use compression. I have ladies that ask me all the time, why do they have to use that compression? We need to use that because it helps separate out the breast tissue so we can, I guess, essentially say we can see through it. So it helps aid in detecting any small breast cancers that might be hiding in there. So that's really why we have to do that compression. But again, there are certain things that you can do to help make it a little easier, which is, like I mentioned, scheduling it at an appropriate time.
Okay. Any sort of meds required, medication?
No, not at all.
No.
Okay. Unlike everything else, colon, whatever, all that stuff, you got to take all kinds of stuff.
The only downside to it is we don't let you wear deodorant when you come in that morning. You have to put it on afterwards.
Okay. So once a woman has a mammogram, if she gets a call saying she needs to come back for more pictures, should she be worried?
I know their anxiety is through the roof when they get that call that we need to take more pictures. They saw something. And there's usually not a whole lot we can do to alleviate all the fear, but I would say in the vast majority of these ladies, it's going to end up being nothing. So if they can put that anxiety kind of at a lower roar, tone it down a little bit, which is kind of hard to do, it would be beneficial to them, because it's more the exception than the rule that usually we don't end up finding anything that they need to be concerned about.
Okay. So after a mammogram, it's not routine that you have an appointment with them. If you find nothing, of course, you're going to call them up and say, oh, everything's wonderful, da-da-da. But that person who receives that phone call that says you better get in here, what do you say to them?
When they get called back for additional imaging, you mean?
That has to be a tough one for...
It can be. And we usually you don't go into a lot of detail with exactly what we saw. We usually just say that we detected something, and we'd like you to come back for some additional pictures. And once they are actually there, then we could expand a little bit on what it is we're looking at. That helps to alleviate some of that concern. And then once they do come in for that diagnostic mammogram, that is what Dr. Boone alluded to when we first started. The radiologist then reviews it right then and there and gives her an answer as to what his recommendation is going to be as far as follow-up.
Okay. Unfortunately, most of the time for these patients, as Diane said, we find out that really there isn't anything to be concerned about, or frequently that it's something that doesn't look terribly worrisome. Maybe we just need to do another study in 6 months to check it again. So it's actually the exception that patients need to have biopsy or things beyond that.
Okay. Is radiation in play here, or is it always surgery if you find something?
Oh, if you find something?
Yeah.
Most of the time there would be some sort of surgery involved, and that would be a discussion that she and her surgeon would have to have, because in this day and age there's a lot of options. There was a time when there wasn't options, but today there is. So that would be a discussion that she would then go on to have.
But unlike lung cancer or whatever, you don't use radiation?
Well, we do sometimes use radiation to treat breast cancers, but actually in women who have abnormalities on their mammograms or on their ultrasounds that need something above and beyond that initial mammogram or ultrasound, need a biopsy, in fact, the vast majority of those turn out not to be cancers. So if you look at everybody who has an abnormality on imaging that we say that needs to be biopsied, probably 85% of those turn out to be benign. So, and the good news is, as Diane said, these days we have these minimally invasive techniques for biopsying. Back when I was a kid and started, every woman who needed a biopsy had to have a wire put in her breast and go to surgery and have an anesthetic and a fairly significant incision and a fairly significant piece of tissue removed to get a diagnosis. Now, almost everyone has what we call a core needle biopsy, which is very focused just on that small area of abnormality in the breast. And again, a minimally invasive procedure that's frequently done with just local anesthetic. They come in, they get it done, they walk out the door and get back to their normal life that day.
That's because we have better imaging too. Is that
we have better
correct?
Imaging. Again, we have these abilities to take these pieces of tissues through these small needles, and we have better ability to interpret those. Our pathologists have better ability to make a diagnosis on less tissue.
Very interesting. Hey, guess what? It's the bottom of the hour and time for the news. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
We understand the one-size-fits-all approach doesn't always work. We do customized compounded medications based on your doctor's prescription to match your specific needs. Hi, I'm your pharmacist, Brad White from the Medicine Center Pharmacy. Do you use or need customized compounded prescription medications because of allergies, special formulations, or need an easier way to take your medication that isn't available? Many physicians choose to prescribe a medication that is not commercially made and requires a pharmacy like ours with special equipment and training to prepare a capsule, suspension, cream, or tablet. Are you sensitive to lactose, dyes, or need a sugar-free suspension? The Medicine Center Pharmacy is here to help you. Every day we prepare custom medications for infants, adults, and pets in our PCAB accredited compounding lab. Call or stop by the Medicine Center Pharmacy today at 551 West High Avenue in New Philadelphia, where wellness begins.
Hey, we did it. 50% off on all Halloween costumes and all Halloween accessories. Wait a minute. It's already half off at the Half Off and Out By store. You are right. We're taking an additional 50% off now until Halloween. So hurry. Best selection is now, and we have some great stuff. Everything else in the store is 20% off. Don't miss this sale. It's a monster. The Half Off and Out By store in Louisville, next to the Medicine Center Pharmacy. Hey, we're giving flu shots, too, at the Medicine Center right next door. Don't forget to get your flu shot.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
It's that time of the year again. It's time to protect your family against the flu virus. Hi, this is pharmacist Paul White from the Medicine Center Pharmacy. Flu vaccination should be a priority to you and your family, so take the steps today to protect yourself. Visit us at any Medicine Center Pharmacy and get your flu shot. And don't forget to stock up on items to boost your immune system like probiotics and multivitamins. Medicine Center Pharmacies are conveniently located in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
You are listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today we're talking about breast cancer treatment with Dr. Greg Boone, breast cancer surgeon, and Diane Wofsey, breast cancer nurse navigator from Mercy Cancer Center. We have a lot more to cover this morning, so let's get back to the show.
Okay, we had a question from Kay in Canton, and she wanted to know how often men get diagnosed with breast cancer.
Well, annually across the United States, there's about 1,400 men that get diagnosed, which when you think about the 250,000 women that get diagnosed, that's a relatively small percentage. However, about 500 of those men will pass away from that disease. They have a tendency to be diagnosed at later stages, in part because they don't always think about the fact that they actually have breast tissue there to get a breast cancer in. So if they see a lump or they see something that's not quite normal, they tend to ignore it. And it's usually their wife or their girlfriend that says, hey, get into the doctor and get this checked out. But that is about how many men get diagnosed. So guys aren't exempt from this.
Do we have any stats on how many men get this annually?
1,400.
Oh, okay, I didn't hear that. 14 in this country.
Mm-hmm.
Okay.
Interesting.
So the lady comes back for additional imaging, and what would she expect next?
Well, that's, if her imaging suggests that there really is a problem that we need to be concerned about, this is where we want to get our surgeons involved. So, in coordination with our radiologist, we'll sit down together, we'll review those images, we'll sit down with the patient, examine her, get a history, and then try to formulate a plan. How are we going to diagnose this? How are we going to find out, is this a problem or isn't it a problem? And again, as I mentioned earlier, the good news is a large percentage of these patients, these turn out to be benign. So even if you need a biopsy, it doesn't mean you have cancer. 85% of the time, these things are going to turn out not to be cancer. It's that 15% that we're trying to find. So that's the next step in the process, to sit down with the surgeon in conjunction with our radiologist to formulate a plan. How can we do a biopsy? And these days, again, we can do minimally invasive biopsies with small needles that are really fairly quick, simple, low morbidity, meaning low risk.
So we don't need a large sample.
We don't need a large sample these days to get a diagnosis.
Okay. Like in the past, I suppose, surgically, we had a chunk of stuff.
Yeah, right. Okay. Which, again, was uncomfortable and left scar tissue that made future mammograms more difficult to detect things on. So the technology has really improved and made it a lot easier and better for ladies.
Okay. So you probably have to handle some of the anxiety here.
I do.
And so how do we handle that in the process of trying to figure out what it is, if it is, and okay, so you have breast cancer.
Every woman, I guess, kind of handles things differently. Yes, we see a lot of women that, I guess I could say, fall apart.
Yeah, sure.
I mean, let's face it, that diagnosis, your life flashes before your eyes, and you think of every worst case scenario. Maybe your kids are little. Maybe you haven't seen grandchildren yet. Maybe your kids haven't gotten married yet. So all of those milestones that we all think about going through, now all of a sudden we have this diagnosis, and all of that is put into question. How much longer am I really even going to be here?
Yeah.
So, but again, everyone handles things so differently and how they cope with things. So I kind of take my cues from how they're handling things, but also letting them know that they're not going through this alone. We're all there to help them through every step of this journey, regardless of how many steps we have to take. And yes, we may stumble, we may fall, but we're going to get back up and do this together.
And one of the important things from my perspective is giving the patient the knowledge they need to understand the disease and what's happening to them, because it's so true that knowledge is indeed power. And so for me, that's about an hour and a half, 2-hour visit with a patient to really go over things and help them understand what's happening. And a great day for me is if that scared, frightened patient walks into my room and an hour and a half, 2 hours later, walks out a little bit less frightened than they were when they walked in. That's a real win for me. So, one of my most important jobs isn't in the operating room. It's in that office, talking to them and explaining what's going on, how we can approach this, what the outlook is. And I think we can reassure a lot of patients by giving them the knowledge they need to make good decisions for themselves.
Is there a standard protocol in America, surgical protocols? I don't even know exactly where I'm going here, but
there are guidelines that are out there. They're called NCCN guidelines that pretty much everyone follows. I mean, granted, there are times when there are kind of exceptions to those rules, but yes, you do look at these guidelines that are published nationally and kind of follow those algorithms.
Yeah.
And those help us to make treatment recommendations to patients. But most patients have options these days. There's not, one treatment that everybody has to follow. So most patients have options. And again, one of the important roles that we all play is to help the patients understand those options and the pluses and minuses of them so that they can make a good decision for themselves. And again, it's important for the surgeon to do that, and Diane and her team really do a fabulous job of helping our patients understand those things as well.
All right, why don't we talk about risk avoidance and what a woman can do to reduce her risk of breast cancer?
I think this goes along with having a good, healthy lifestyle. And if you do that, you're going to reduce your risk for a whole lot of things. Maintaining a healthy weight, eating a good, well-balanced, healthy diet, avoiding excess alcohol. Don't smoke. If you do smoke, quit. If you don't smoke, don't start. So I think if you do that, those are all the things that they recommend that will lower your risk. Does it take it away completely? No. I know very healthy women that still get breast cancer, but it does lower your risk. But at the same time, it lowers your risk for a lot of other health problems that you could go on to develop. So overall, those things help you be healthy in general.
Well, there's genetic issues too involved here, right?
Well, there can be, but only technically about 5 to 10% of all breast cancers are actually the type that are truly genetic.
I see. Okay.
Right. So it is a concern, of course, but it is the minority of breast cancers that are genetically caused. So it's something that we look at, and we try to get a good family history. And there are certain populations of patients who we do want to test for genetic problems. So if you're very young when you're diagnosed, if you're younger than 50 when you're diagnosed with your breast cancer, you're probably someone who needs genetic testing. If you have a close relative who's had breast cancer and you also have breast cancer, then you probably need genetic testing. If you have multiple family members with breast or ovarian cancer, that's someone who's going to need testing.
What would we find out in the genetic test? I mean, what's it tell us?
Well, a few years ago, there were only 2 genes that we were aware of, the BRCA1 and 2 genes that we knew were associated with breast cancer, and now there is a whole slew of genes that are associated with it. So, we work, again, another team player is our genetics team, so we send people for genetic testing, and geneticists get a very thorough family history, and they analyze that history and then suggest, based on that history, tests that need to be done, and then we can do these panels of tests to see if there is indeed a gene that we need to be concerned about, which of course has impact on that patient and their family members.
What about symptoms a woman might have on her radar for identifying the possibility of having some breast abnormality or breast cancer?
Any change from how the breast usually looks or feels should send up some sort of red flag. Does that mean it's a breast cancer? No, but it needs to be addressed. So that could be anything from all of a sudden you notice that there's a dimpling in the skin, maybe a change in the color, maybe the nipple is retracting in or becoming inverted, and it wasn't like that before. Those are all things that should be addressed by her healthcare provider sooner than later.
What about, we mentioned when it's recommended to get your first mammogram, 40, 45. What about breast self-exams? When should those start?
Well, that's another controversial topic.
It is.
I mean, I personally think when you have breasts, you should probably start examining them. So young women aren't going to get screened. I actually think it's more important in younger women than anyone else because they're not going to get mammograms. They're not going to get screened. Younger people tend not to go to the doctor as often, so they're maybe not going to get examined as often. So I really emphasize to young women that learning how to check themselves and get used to what your breasts feel like, because everybody is different. And honestly, the best person to know if there's a change is that person. I mean, I'm not as good at that as that individual lady will be at doing that. So I personally think it's important to encourage young women to start doing breast exams.
Okay, you've kind of, every time we talk about this, I think about the hormone aspect. Given that we provide some customized medications at our pharmacy, and a lot of women are looking for hormone-related anti-aging options, you say 40, 45, we start to screen, and then your risks kind of increase. And I'm thinking on the pharmacy biomedical side, I'm thinking about when your progesterone levels start to fall and your estrogen levels start to rise, and you have that situation which maybe there's that estrogen dominance and maybe more active hormone. Does that seem to be in line with thinking of why we could have increased risk if we have more estrogen in the body that's unopposed with progesterone to balance it out? And because aren't many breast cancers estrogen dominant or estrogen fed?
Well, certainly unopposed estrogen exposure is a factor. So we know some of the things that increase your risk are early menarche, meaning starting your periods early, younger than 10, never having a child or having your first child later in life after age 30, having menopause be later in life. Most women it's around age 50, so women who are more like 60 when they have menopause, that risk is higher. And all those things are because there's a longer period of time in which they have exposure to estrogen without some kind of interruption. So having children is protective. Breastfeeding, which tends to suppress estrogen production, is protective against breast cancer. So, yeah, there certainly are hormonal factors. 10, 15, 20 years ago, lots of ladies who went through menopause or had hysterectomies and ovaries removed were put on estrogen replacement, and we do that much less frequently now than we did in the past because we know that there's a risk to doing that.
Okay, final breaks here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hey, we did it. 50% off on all Halloween costumes and all Halloween accessories. Wait a minute. It's already half off at the Half Off and Out Buy store. You are right. We're taking an additional 50% off now until Halloween. So hurry. Best selection is now, and we have some great stuff. Everything else in the store is 20% off. Don't miss this sale. It's a monster. The Half Off and Out Buy store in Louisville, next to the Medicine Center Pharmacy. Hey, we're giving flu shots, too, at the Medicine Center right next door. Don't forget to get your flu shot.
The warmer weather is here. Hi, this is Brad White from the Medicine Center Pharmacy. Perhaps you've gotten the urge to venture outside and clean up the garage or do some yard work, resulting in muscle aches and pains. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacists can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Today we're discussing breast cancer treatment with Dr. Greg Boone, breast cancer surgeon, and Diane Wofsey, breast cancer nurse navigator from Mercy Medical Center. Let's get back to the last segment of the show.
What about diet? You mentioned a little bit about healthy lifestyle. Any special foods or supplements that women should be concerned about with estrogen exposure? I know they pump an awful lot of stuff in our poultry and things these days if you're not careful.
They do. And usually our dietitians and even us tell patients everything in moderation. Do I want people after they've been diagnosed to go out and start buying expensive, all organic, all this kind of stuff? Not necessarily. But use common sense is probably the bottom line for this. But do they have to go out and follow any real rigid, strict diet? No.
What? Okay, you hit the diet word. What about a vegetarian? I mean, do we have any studies on whether there's more or less breast cancer in vegetarian women?
I'm not aware of anything in particular about vegetarian diets. I think we all believe that low-fat diets probably have benefits in preventing some kinds of cancers, although the honest truth is that there's no clear-cut link between low-fat diets and breast cancer prevention. So we haven't been able to prove that, but our good common sense tells us that this is better for our health just in general.
Well, the big thing, of course, is against beef right now and meat products. That once a week you're allowed to have beef now, as opposed to people lived on it. I mean, farmers lived on this and grew up with this.
But I guess when you think about it, I often think of my grandfather who used to walk to and from his job every day.
Yeah, well,
where a much more sedentary population these days, so it's probably not balancing things out like we used to either.
Mm-hmm. I've kind of given up on meat to some extent. You know, I kind of live with that once a week, you know. But there's a lot of people who just can't.
No.
You know. Okay. What are some surgical options for breast cancer? Are there various types, or?
Yeah, I think most women do have options if they're diagnosed with breast cancer. It depends, of course, on the size of the tumor, the extent of the tumor in the breast, the size of the breast, and a lot of things. But the vast majority of women do have options. You know, I think when they hear that they have breast cancer, the first frightening thought in their mind is that I'm going to lose my breast. Mm-hmm. But the truth is that most women don't have to lose their breast these days. We can do things to preserve the breast. So what's commonly called lumpectomy is a good option for a large percentage of women who have breast cancer. We can even take cancers that are larger and shrink them by using chemotherapies and things like that up front before we do surgery, and sometimes take a tumor that might not have been a good candidate for breast conservation and turn it into someone who can have a lumpectomy. Some women prefer mastectomy, so it's one of those things that I feel very strongly that one of my jobs is to give patients, again, the knowledge they need to know what's the option that I have, what are my options, what are the good and bad things about each of those options, so that they can make a good decision for themselves. It's really not the old paternalistic way where the doctor's telling you this is what you have to do. There really are options these days, but patients need information and knowledge to make those good decisions for themselves.
I guess I always heard that if you had radiation treatment, you could not have surgical treatment. Am I all wet on this?
Yeah, I think you are. In fact, we use radiation in conjunction with surgery quite commonly.
Okay.
I would suspect that the most common operation we do for breast cancer these days is a lumpectomy. And almost all of those ladies who have lumpectomy, with few exceptions, will then go on to have radiation treatment in conjunction with that surgical treatment. And that not only reduces the risk of local recurrence, but in some cases can actually enhance survival.
So after you surgically removed a lump, if you will, does everybody have to have radiation?
Well, the majority of people do. Again, there are some exceptions, some non-invasive tumors, very early-stage tumors, if they're small enough, depending on the patient's age and some other factors, may or may not need radiation. But by and large, if you're going to preserve the breast, radiation is usually part of that treatment.
What about, I don't think we touched on support groups very much. Can you talk to, I guess, the mental well-being of a patient or a family member of a loved one with breast cancer, or even the process? So
we do have a specific breast cancer support group that meets the second Monday of each month at 6 o'clock in the evening. Anybody's welcome to come. They don't necessarily have to. It's not limited to just Mercy patients. Let's put it that way. We have also what we call a complementary medicine program at Mercy. We have massage therapists who volunteer their time. A half-hour massage is $5 for someone in current treatment. So they can come in and get a massage. We found that helps them to relax and get through treatments much, much easier. We have our Mercy Boutique, which has wigs, hats, scarves, skincare products, mastectomy bras, breast prostheses if she chooses not to have reconstruction. So it is literally a one-stop shop that they can come in, and it's easily accessed right straight on the ground level of our surgery center area. So we have a lot of these different programs in place that the patients can participate in.
And I can't emphasize how important those things are. Cancer doesn't end when treatment is over. It's always there. It's always a part of your life. And so these kinds of support groups can really be game changers, and the survivorship aspect of this is very important, and it's something that we spend a lot of time working on and helping our patients with.
So we're a little tight on time, folks. We got 3 questions we'd really like to get an answer to. What about breast cancer clinical trials? Single most important word of advice for our listeners when it comes to breast cancer. And what did we maybe miss today?
Well, Mercy does participate in clinical trials for breast cancer. If we do not have one, we have a network that we can find a clinical trial for them. So clinical trials are not a problem. We definitely participate in those. I would say for me, you mentioned what the final takeaway message is. Okay. 1, pay attention to what's normal for you. 2, get to the doctor if you find something that is abnormal and not what you feel is going on normal for you. And 3, early detection. Get those mammograms done.
And that there's great hope. We do well with this disease, so this is not a death sentence. This is something that is eminently treatable and frequently and usually curable.
Wonderful. Thank you, Doctor, very much. Dr. Greg Boone, breast cancer surgeon, and Diane Wofsey, breast cancer navigator from Mercy Medical Center. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to Mercy Medical Center, Kiko Auctions, and Studio Arts and Glass for sponsoring today's program. And, of course, our technical producer, J.D. DeAngelis. As always, we thank you, our listeners, for joining us on Health Matters with the Medicine Center Pharmacy. We are a local Health Mart pharmacy, caring for you and about you. Have a healthy week, and we'll see you again back right here Friday, right after the News Talk 1480 WHBC.
The preceding program was sponsored by the Medicine Center Pharmacies.